Okay, welcome, Dr. Greg Smith. Thanks for joining me today. Thrilled to have you on. And we're going to talk about GLP-1s and about this revolutionary breakthrough in peptides that's happening right now. Before we get into that, I would love to hear about your background. You have a fascinating background. Tell us a little bit about how you came to be a doctor and your work history and just a little bit about yourself.
Great, Chris. Always good to have conversations with you. Yeah, thank you for recognizing my previous both medical training and but my military experience, which I continue to hold near and dear to me, to my heart there.
Yeah.
So I trained after going to medical school. I trained in preventive medicine, which way back then in the 80s was pretty new, pretty cutting edge, and we were going to look at promoting health. Wellness was not even a word back then, I bet.
Yeah.
And so we were getting away from the disease model and into what's become the wellness model to help our patients. So I did my residency at Walter Reed in preventive medicine, then went to Harvard University where they had programs early on in the 80s training. So did my master's degree there. And
Okay.
um, and during my time in the Army, weight was a big issue, even back, and this is the late 80s, early 90s.
Right.
And here's why. The soldiers had to meet a weight and height guideline.
Uh-huh.
So if you didn't, you could have been in the army for 15 years and you're out of a job. Your career is over if you don't
Sure.
meet the weight
Yeah.
or height. We had phentermine. We had some old weight loss medicines. I'll tell you about fen later, but back
Yeah.
then all we had was some medicines that help you lose your appetite, and then they lasted about 6 or 8 weeks. Then they stopped working.
Right.
So we could get
Wow.
10 or 15 pounds off the soldier and make him so he or she could pass the standards and stay in the army. And I
Right.
had clinics of that for several years. Then I got out, became a civilian, just in time for the fen craze.
Yeah, yeah. So let's talk about fen because I think that's something that stuck in my mind when the GLP-1s like Ozempic, semaglutide, tirzepatide really came out. Really got popular about 4 or 5 years ago. My mind immediately went to fen because it was such a disaster. So tell us about your experience with that. I know I didn't realize until we spoke a few weeks ago that you had deep experience with this. Tell us about that.
Yeah, and I did use the word craze on purpose. It was a craze,
Yes.
and it did not last long. So let's say the 92, and it was off the market by the FDA by 97. So, but it was a craze because it worked. It was cheap. It was safe until we found out it wasn't.
Right.
So it was safe in the day-to-day use, but then we found out there were these terrible long-term sequelae or adverse effects that happened in up to one-third of the patients in their heart valves. So, once those papers came out, it was quickly taken off the market. But we had 4 years at least there where every 3 blocks next to the yogurt shop and the smoke shop was a fen clinic. They were
Right.
everywhere. And it was $100 a month to see the doctor. It was really cheap. The meds are really cheap, $10 a month. And it worked. People were literally urinating out their fat. So it was
Wow.
affecting you such that your fat turned into what's called ketone bodies and you're urinating it out. So, and also when you lost the weight, you could stop it. Now, if you hadn't made the changes that we're going to talk about later, it's going to come back.
Right.
But you could stop it, and it's a really nice way to get rid of your fat. Is urinating out ketone bodies is a great way to lose fat tissue from your body.
Interesting. Interesting. And so you had fen clinics.
Yes, yes, fen clinics. Yes, and urgent care centers. And overnight, the demand it was, again, a craze. It was everyone
Yeah.
knew about it. This was before the internet. So they were learning about it on the news. But
Right.
so my urgent care centers had the lines around the corner, um, you
Wow.
know, coming in. And again, it was safe as far as we knew,
Right.
until we found out when the papers got published that there were some people having these long-term problems that you only find out years later. And that's we constantly had to be cognizant of that when if it's too good to be true, it's too good to be true. So
Right. Right.
that was
Well,
fen.
yeah, and that I think that's where a lot of people are at today with the GLP-1s. And when I say GLP-1s, I'm speaking of semaglutide, tirzepatide, Ozempic, Zepbound. It's all a classification of the GLP-1s. So why are GLP-1s different now? How are they better, safer?
Okay, okay, very, very good question. So, fen-phen were two different drugs. These were chemicals we were put in our body to have an effect like a natural effect, but it's not natural, it's a synthetic effect.
Right.
These are peptides. These are natural. The peptide is a small combination of amino acids. So a row, imagine, a small train with six cars in it or 12 cars in it.
Mhm.
That's how small these peptides are, small little molecules. And because they are small molecules, they break up really easily. They're very fragile, like an eggshell. So they're almost always injectable
Okay.
because the stomach will tear them up and turn them into amino acids, and they're no longer a peptide.
Right.
So it's like breaking a train into a bunch of train cars, and it doesn't
Got
do
it.
the same thing anymore.
Right.
So that's why we only ever have peptides that are injectable, except for the one new Rybelsus, which is an oral form of Ozempic.
Right.
But in general, peptides from now and into the future will mostly be injectable.
If somebody's considering this, why isn't this going to end up just like fen-phen?
We all know injectable peptides, and we all love them. And there has been very common use of them for 20 years. Botox.
Oh,
Botox
interesting.
Botox is a peptide and has to be injected, and it has wonderful effects just on blocking one particular type of nerve transmission that makes muscles twitch.
Interesting.
That's all Botox is. So the peptides are an amazing tool, and it's a natural tool. And so we're going to see a lot more. We'll talk maybe at the end about the future of where peptides are going to go. But they
Yes.
have been around for a long time. They are natural in their effects, and they have a receptor that they work on. In every case, we're not giving you some drug. We are stimulating a receptor or blocking a receptor, one or the other.
So in effect, when people take a GLP-1, which by the way, what does GLP stand for? For our
Oh,
audience.
glucagon-like peptide.
Okay.
Glucagon-like peptide. One
So
type one.
type 1. So in effect, you're giving people a synthetic version of something that their body already produces. Is that accurate?
Right. So our body produces glucagon,
Right.
which is a peptide. And so this is a similar peptide that acts like glucagon.
Interesting. And
And
it's
that therefore mostly really safe, but we'll talk about safety issues next.
yes. Yeah, let's talk about that because I think a lot of people are still afraid of them. They're afraid of some of the side effects and things like that. Let's just go deeper into the safety of these drugs.
Safety with all of these drugs has to do with how specific we can target the action. So
Mhm.
if we could just have a peptide that went right to the two centers we need it in the body, so in the brain and the hypothalamus, we need it to go up there and stimulate, and then in the pancreas, we need it to.
Mhm.
So if we just could target those two, then we wouldn't have all the side effects.
Right.
But because the way semaglutide works, it does those two things beautifully, but it also does things along the small intestine, stimulating things. And that
Mhm.
can cause the gastrointestinal problems, which is mostly what we're going to hear about with side effects from these medicines is from the stimulation along the small intestine causing
Mhm.
the issues. Some nausea, some diarrhea, constipation, belching, things like that. So all gastrointestinal kind of symptoms
Right.
that get less and less the longer you use the medication.
Okay. And so let's dive deep into the mechanism of action. How do these drugs truly work?
Yeah. So, Chris, GLP-1s work. All these medications all work on the same receptors, the GLP-1 receptor,
Okay.
which is present in our hypothalamus. This is a small part of our brain that has to do with our appetite. This is where we are motivated to go and do something. This is where we think about, I would like to go get in my car and drive and get a pizza.
Yes.
That thought is coming, and the motivation to get in your car and drive to get the pizza is all getting driven by that hypothalamus. This is
Interesting.
where food noise comes from, the same
Yes.
place, the hypothalamus.
Right.
So when we stimulate this particular receptor in the hypothalamus, those noises are turned down. Our motivation to get in the car and actually go through the yellow arches is decreased, and our thoughts about food are decreased. Furthermore, when you put the food in front of you and you haven't eaten in hours, you're still not that interested. You're
Right.
just not that interested. So that's how it works in the hypothalamus. So then what does it do in your body? Well, it goes to your pancreas and it tells you to make more insulin.
Right.
So, and it also works on how we use up fat. So it sort of tells us to use up our fat to
Hmm.
make sugar. So get rid of our stored fat, turn it into sugar so we can use that to run our muscles.
Hmm.
And it tells us to make more insulin, so that pushes the sugar into our muscles where they're needed to work.
For energy.
So two ways is taking stored calories and using it away from obesity towards more metabolic efficacy, a more efficient metabolism.
These breakthrough drugs are stopping the root cause of obesity, which is the eating. They slow that down in a very natural way, basically turn off your cravings and hunger so that you don't eat the food to begin with. Because things like Feynman and a lot of these stimulants, they were really about burning the fat that you have. They were about boosting your metabolism, or fat burners in general are about boosting your metabolism. And a lot of them have caffeine in them, and a lot of them are about really cranking up your metabolism so that you burn fat. But this is doing it before you even eat it. And then it's telling your body to burn the fat instead of, because you haven't eaten as much, so burn the fat for energy. Is that accurate?
Those are two out of the three. And those are the two out of the three that we really, really like,
Yes.
the effects. The
Yes.
third one is where we get into some gray zones, and
Okay.
this is the same receptors that are in our stomach and small intestine.
Hmm.
So when we stimulate those, we tell them to slow down. So you eat a small meal, it stays in your stomach, and you feel full.
Right.
So you feel full, and you feel full for a longer period of time. So that's all what happens when we stimulate the same receptors in our stomach and small intestine. Unfortunately, if you do that too much, then you can feel, you know, nauseous, too full. You
Right.
could have make some gas,
Hmm.
so some diarrhea sometimes when things speed up again. That's where all the issues come from these medications. But the two areas are perfect, and that's where the future is going for a GLP-1 medication that only works in the brain and the pancreas and
Ah,
bypasses the center part.
interesting. Okay. So let's talk about, we've got really three drugs now that are becoming super popular. You get the semaglutide, which is the original Ozempic that most people associate with this. But that's only one drug. Then there's tirzepatide. What is the difference between these two?
Tirzepatide is a combination. So it has the GLP-1 stimulator that we get with the Ozempics.
Yes.
But then it also has a GIP, which is a long name for glucose dependent insulinotropic polypeptide.
Oh my
So
goodness. I'm glad you said that, not me.
I think we'll stick with GIP.
Yes.
Um, and, and what that does, that works in the small intestine,
Okay.
almost in the opposite direction. You see how that's where we have the problems is the small intestine
Right.
activity.
Right.
So, so with the tirzepatide, we're able to block and more balance what's going on in the center, in the small intestine and stomach, with fewer side effects, and we actually get better weight loss.
Wow. So it's actually, it's still acting on the hypothalamus in the brain,
Yes,
still acting on the pancreas, but it's actually in some ways reversing some of the action in the digestive system that makes the semaglutide so uncomfortable.
yes, it's the main reason people would stop using these medications is the stomach symptoms.
Yes.
They're not life threatening, they're not going to put you in the hospital or emergency room, but if you have them day after day, that they may be a reason for you would stop using the medication.
Interesting. Interesting. Okay, so from your experience with them, what do people typically experience with these drugs when they take them? What happens?
Yeah, yeah. So let's start in the brain and work down.
Yeah.
Okay, so what happens in the brain? They start noticing these effects. So these are the GLP-1 effects where we just talked about, where the food noise goes away, their their interest in food, their motivation, how frequently they think about food goes away. The amount they eat is less because now they're starting to feel full
Hmm.
more quickly, and they're going to stay full. So it takes longer before they want another meal.
Right.
So, and then you don't notice this, but then going on in your pancreas are these metabolic activities using up the fat that's all around your organs. So this specifically targets the fat that we store around our organs that give us a beer belly.
Hmm.
Um, and so that is going down. And actually, there's some increase in muscle mass. They're getting a more muscle mass, less belly fat. And these things are pretty dramatic. At 1, 2, 3 months, you really noticed.
Yeah, I mean, I have some friends who've lost hundreds of pounds, and it's really given them their life back. One gal that I'm very close to says that she's back wearing the size of jeans that she wore in high school. She was diabetic and borderline obese, and it was having all these knock-on effects. It affected her foot and ankle. She had so much extra weight on her that there was so much pain in walking that she couldn't exercise. So she was in this spiral where couldn't exercise, and that led to a depression, which fed the eating, and the eating increased the weight gain, and it was really to the point where she was probably going to die from this, right? And these GLP-1, specifically tirzepatide, even at a very low dose, allowed her to lose 110 pounds. She's playing tennis again. So many of the knock-on issues that she had, the pain, the joint pain, the sleep problems, in addition to the food noise, have gone away. Is that common? Do you see that often?
Yeah, and you know what? It's always nice to hear it from a non-medical person because this is life-changing.
Yes.
We're not just taking some weight off so they look better in a bikini. That
Right.
that would not be very rewarding to me as a doctor. That I don't care about that. Some doctors care to make people look better in bikinis. I
Yeah.
don't.
Right.
Um, the metabolic syndrome. I think we've heard of the metabolic syndrome.
Yeah. Tell us about that. What is that?
It was not a diagnosis until the late 1970s. So it did not occur, was not recognized. I think we all know what happened with the high fructose corn syrup that came out in
Yeah.
the 70s. So by the 80s, the volume of the high fructose corn syrup on the market had started the obesity epidemic. So we went from about 2% of the adult population was obese in 1970 to
Hmm.
we are now over 42% of the adult population is obese. And so we can talk about that a little bit later. But so now what that obesity, what is that doing? That is causing incredible inflammation wherever this fat is being stored, the organs it's being stored around are sources of inflammation. So the fat is not supposed to be there. It's like marbleized fat, and like when you see those steaks that are super marbleized,
Right.
that's a cow with metabolic syndrome.
Oh,
Okay,
interesting.
that fat tissue is not supposed to be there. It's supposed to be nice striated muscle,
Right.
and yeah, and so that fat is not supposed to be there. And
Interesting.
what that fat does is irritate all the other cells, the healthy muscle cells, and that's inflammation. And so you have chronic inflammation in your organs and throughout, especially the central part of your body where your organs are stored. So that inflammation then is what causes the condition. So we high blood pressure, fatty liver, um, polycystic ovary disease,
Hmm.
cardiovascular disease, and then what you allude to next is with all this extra weight, joint degeneration.
Yes.
So the weight bearing joints, the ankles and knees and the hips. So all that's called metabolic syndrome.
Interesting. Okay. So it's really a collection of symptoms all caused by just excess fat, essentially. Sounds like.
Fat is the underlying cause for all of that. The abnormally located fat.
Yes. Okay.
Okay, so it's not the fat we're storing in our love handles, which I used to have from going to Dunkin' Donuts every morning. Um, that is normally stored fat. This is the abnormally stored fat that occurs with fructose, with too much fructose in the
Interesting.
diet, because the body doesn't recognize fructose as sugar.
Interesting.
And so it just stores it away wherever it finds it, just pockets it away.
Wow. So tell us a little bit about what these drugs do for diabetes, because like we have a lot of clients who struggle. I think the weight is a part of that, but their primary concern is their diabetes.
Yeah, good question. So we used to say diabetes was not reversible, and just in the last few years since these medications come out, we now had to rethink it. It is reversible. So diabetes, that we know it happens with too much inflammation in the pancreas. So there's this abnormally stored fat occurring in the pancreas,
Mhm.
causing inflammation, and then lots of excess sugar in the bloodstream. So the pancreas is working overtime
Hmm.
at the same time as having inflammation. So you actually have, it's a very funny type of diabetes where you have lots of insulin. You don't have to give the patient insulin early on in the disease. They're making more than they're supposed to, but
Interesting.
it's an abnormal effect. The gas is being pressed down full
Right.
time on
Right.
the pancreas. It eventually
Interesting.
burns out.
Okay.
But so that's what happens with this particular form of diabetes, type 2 diabetes.
Hmm.
And now we used to call it adult onset diabetes. And for the first time, I think sometime in the early 2000s was the first time a child was diagnosed with type 2 diabetes. So
Wow.
this did not occur.
Wow.
Now it does occur.
Wow.
We've got 20% of teenagers and preteens are now morbidly obese in this country. So this is all the same things, the same dietary and lifestyle issues that impact adults.
For the critics who argue that this is a band-aid, or for the people that say this is for people who are too lazy to lose weight or too undisciplined to change their diet, or they're just looking for a shortcut, what do you say to the critics?
When it's so motivational to get this amount of weight off relatively easily,
Hmm.
safely,
Hmm.
uh, and so now your motivation is not to put it back on again, to make the lifestyle changes. You're looking in the mirror, you're feeling healthier, you're playing tennis again like your friend. You want to stay that way. Talk about motivation to change your lifestyle and diet so this doesn't happen again.
Right.
Much more, in my experience with patients, much superior than saying, okay, do this for the next year and you'll look better, feel
Right.
better.
Right. Yeah, I think for many people, especially my friend who's in her mid 50s, I think a lot of people are running out of time. There are ways to lose the weight and to lower your blood sugar, but they take years and they can take decades for some people, and it's incredibly difficult if you're carrying around a lot of extra weight. They simply don't have that kind of time. You agree with that?
I agree with that. And also, I don't think we can discount what is going on in our brain with these food triggers.
Yes.
These are releasing dopamine. When we see the Big Mac on the commercial,
Yeah.
um, we have a dopamine drop, and we want to go out and go through the golden arches.
Yes.
Uh, and so we are fighting our culture that wants us to go and eat hamburgers and ice cream
Yes.
and and we haven't even talked about the other half, which is the inflammatory lifestyle, which is the constant stimulation
Hmm.
that occurs in our current, let's just call it screen time for lack of anything else.
Right.
Well, that's just constantly releasing cortisol. We're not supposed to constantly release cortisol. It's supposed to be just whenever a saber-toothed tiger attacks us. But otherwise, we should not be releasing cortisol. Now we're constantly releasing cortisol. So we're fighting a culture that is pushing us to be obese and
Mhm.
have metabolic syndrome. So we have to fight it. And I don't think it's a simple fight. Something like this, a peptide is a great, but it's not the solution.
Okay.
It's like, here's the analogy. It's like when you break your leg, you go to the doctor, I'm going to help you with the leg and I'm going to give you a crutch.
Yes.
And then the leg's going to be better. And then you have to rehabilitate. Okay,
Right.
that fracture is fixed. Now you got to rehabilitate so you don't break the leg again. And that's where the change in diet, getting away from the inflammatory diet, and
Yep.
then the change in inflammatory lifestyle. So those two things or how we don't get it again.
I get it. So I assume that you're saying that if you assume these lifestyle things, then you don't have to take this drug forever?
Correct. Now here is the issue, and this is an area of a lot of research. This is a question mark.
Yes.
So now let's go back to fen-phen. We gave you fen-phen. 6 months, you got off 90 pounds,
Hmm.
and we could stop it.
Yep.
You stay, if you had the same inflammatory diet and lifestyle, you're going to put it back on again in about 6 to 9 months.
Right.
So there's not a whole lot of difference here either. There is some training of the brain with the food noise and some of these other responses that our brain learns some behaviors
Hmm.
while you're on this medicine. But you have to have a plan where you're going to change it while you're having this effect. You're learning new dietary changes and changes in your lifestyle. You have to. And I don't have the full answer. Again, there's a question mark, but I don't think you come off these medicines unless you have the new plan in effect
Right.
and working.
And that's exactly what we're trying to do with the Healthy Living Clinic is give people a plan. We have meal plans, we have exercise plans, we have support groups. The whole idea with our clinic, and that's why we signed on with you to help us promote this, Dr. Greg, is that we're trying to get you off the drugs so you don't need them forever because a lot of people are terrified of taking this for the rest of their lives. And so that's why we have meal plans, exercise plans, support groups, coaching, anything you need to help you get the weight off, get off the drugs, keep the weight off.
Let me add to that, and I think good, and I'm proud to be part of what you're doing here, Chris. Um, but while they're going through it, we don't want them to lose too much weight. So they need that coaching. They need their peers to ask questions. That what do you do about this and that? Because we
Yeah.
don't want too much weight, especially with over 50-year-old patients. We don't want too much weight coming off too quickly.
Okay.
We'll get it all off.
Yes.
Give it a year. You don't want it off in 3 months
Right.
because you can lose fat under in the tissues that make you look handsome, your face.
Right.
Makes your butt look good. You can lose fat, so it doesn't look so good in a bikini anymore. So
Right.
we want to work with you through the whole process, so you're not losing too much fat too
Right.
quickly.
Yeah, so a lot of people are concerned about losing muscle too. How do you kind of prevent muscle loss when you're losing so much weight?
It's really simple because of all the metabolic things going on in your body. If you are stimulating the muscles while
Hmm.
these drugs are working, you're
Hmm.
going to be pushing sugar into your muscle cells to make the mitochondria little like it's like putting gasoline into the engine. But if
Wow.
you aren't using the muscles, they're going to lessen. They're going to use them.
Yes.
They will decrease. You've got to have, again. This is where the whole program comes in,
Yes.
and this just basic weight training, but the sort
Right.
of stuff that you have with your program. And the peer group, I can't underestimate too much. What did you do about that? They're 2 or 3
Yes.
months ahead of the other patient. And, well,
Right.
this is what I did then. The gastrointestinal symptoms.
Yes.
Another great time for the peer group to, okay, what did you do about this or that?
Right. Excellent. Excellent. Okay, so for somebody who's considering this, what are some of the things that they should think about before getting into the GLP-1s like tirzepatide and Ozempic and these?
I think if they have a full-blown metabolic syndrome, diabetes, some
Mhm.
heart disease, they need to make sure that their doctor clears them.
Mhm.
Um,
And
and
at a Healthy Living Clinic, you will speak to a doctor that will interview you and will go through your lifestyle, the drugs you're on, and all these things to confirm that you're eligible and this help you decide if this is a good option for you.
correct, and they will find that their doctor, at Healthy Living will become their doctor.
Right.
This is a big part of their life. These metabolic issues.
Right.
It's not their family doctor, but it'll be their metabolic doctor, dealing with these various issues. So
Right.
one, if you have these risk factors that are pretty far along, then you make sure that you really listen to what your doctor's telling you. And so that's where I get concerned when there's too many other medications going on at the
Yes.
same time.
Right.
But if they're basically healthy, they're just obese with maybe some pre-diabetes,
Hmm.
mildly elevated blood pressure, so there's not much to lose. It's all something to gain.
Right.
benefits to gain, not weight. But it's amazing how this stuff works. You just get confident with it. It's going to work.
Yeah.
It is
Yeah.
going to work.
It's incredible. Yeah. Well, if you guys want to learn more, go to healthyliving.clinic. That's where Dr. Greg is helping us educate people about these drugs. So, Dr. Greg, where are these peptides going? What's the future here?
Yeah, Chris, very good question. So these peptides, again, these are just small little molecules made up of 3 to maybe 12 amino acids.
Right.
So because they're basically considered a food.
Hmm.
So they're generally considered safe. Um, but once you give them through an injection, they may or may, we need to have research. And that
Yes.
research is going on. I would say there's several thousand peptide studies going on at the moment in
Right.
humans. So lots of research. Where are we going to go with this? We're going to go to blood pressure control using peptides, so natural blood pressure control instead of all these blood pressure medicines, which
Interesting.
are potent drugs doing all sorts of things. They almost have a secondary effect of lowering your blood pressure. Meanwhile,
Right.
they're doing all sorts of stuff to your body. Well, we're
Right.
going to go with a peptide that goes and lowers your blood pressure as a biologic function. So we'll see
Interesting.
blood pressure medicines coming out pretty soon.
Yep.
We're going to see more targeted peptides for the metabolic syndrome. So one will be for blood sugar, one will be for fatty liver, which is now epidemic in the country. Something
Interesting.
like 25% of the population with fatty liver, which leads to cirrhosis and liver
Right.
transplant.
Right.
Um, so we'll see those targeted conditions in the metabolic syndrome having peptides. I think the most exciting, though, is the anti-aging
Yeah.
peptides that are coming out. There's 6 methods of action. All of these have multiple studies going on to both slow down aging and reverse aging. So I'd like to
Wow.
go through that relatively quickly.
Yeah. Please do.
Yeah. Yeah. So I think we've all heard of telomeres. Is that pretty much telomeres?
Yes.
Is that
Yep.
common? Yeah. So that's the sort of the end cap on the chromosome. So
Right.
it's something that when that end cap gets really, really small, then you start getting problems with cancer and degeneration. So there are specific peptides that can lengthen the telomere and actually stabilize it so it's stronger. It got more glue on the end cap.
Interesting. Okay.
We have for cellular repair that these are already coming out now. These copper-based peptides in skin products, so that they actually stimulate collagen, elastin, those sort of proteins and matrices that make our skin look youthful.
Wow.
And these decrease, with the sun exposure and as we age. So now we can actually make more of those than we would with natural cells, aging cells. We have a nice peptide that increases growth hormone. So it tells our own growth hormone to release. So release more of our own hormone. So it's more natural when you do that.
Very interesting.
It does
So,
get
can you actually grow with these hormones?
growth hormone is when you're 2 years old you can grow.
Yeah.
Once those end plates close on your bones, you're not growing
Right.
anymore.
Right.
Um,
Right.
but so it's more about having muscle bulk, having energy levels like
Right.
you're a teenager, but you're not a
Right.
teenager.
Right.
Um, Along the same lines is cellular energy. So actually putting the gas pedal down in a healthy way on our cells as we age. So I'm talking about older patients, 60 and older. You could probably start some of these earlier on in your
Right.
skin, etc. But
Right.
we're going to be able to help. In my opinion, you want to be a healthy older adult.
Right.
Who wants
Right.
to be 100 years old if you're in a wheelchair and you can't do
Yeah.
anything?
You're frail. Yeah.
Yeah. So these are sort of the opposite. So they're reversing or slowing down that kind of degenerative, frail part of being elderly.
Right.
And then the last one is for immune recovery. So I think we all know our immune system goes down dramatically after 60, and we
Right.
can't fight COVID and influenza and things like that. So it improves the T cell functions. And so each one of these would be a similar small peptide, maybe once a month. I think we'll be able to get them longer, maybe every 3 months.
Okay.
Um, not once a week now, but yeah, longer. The
Yes.
future less frequent shots. Right now it's once a week, but the future will be less frequent shots.
Right.
Maybe oral stabilization of these peptides. That's the moonshot. Getting oral
Right.
stabilization, like ribelsis, that's the moonshot. If we can get
Right.
that for all of these, then it's one big pill a day for anti-aging.
Yeah, this has been awesome, Greg. Thank you so much, Dr. Greg, for joining us today. This is the cutting edge of science and medicine, and we're so glad to have you on board helping us with this.
Good. Yeah, my pleasure. Be well.
Thank you. Okay, I'm just going to stop.